Hello, everyone. What a dramatic entrance. Not as dramatic as my previous speaker, and certainly a little bit different in style. We're talking about a future that I hope is more realistic. I hope it's not just simulation that we're going to see in the upcoming years when it comes to healthcare. I hope everybody's going fine. Are you all right? Are you enjoying the conference? Yes? Thank you very much for the organization for inviting me here. It is a particular honor to be able to introduce and moderate this session on building a sustainable healthcare system. So what a better way to start a session on innovation with one of the most mystified innovators of our time, and you wonder, I mean, this guy had to do with mobile devices. What does that have to do with healthcare? We're going to see. But there's one thing about this personality which was very interesting, is when he died, there were many things that were put into his mouth as his last words. And one of the alleged last words that he said was that he asked the question, what is the most expensive bed? Do you know? It's the hospital bed. That was his alleged answer. Now, when you look online, you actually figure out he never said that. Although these are meaningful words, he said something way more powerful before he left. So he had his family with him. He looked at the family, at each one of them, and just said, oh, wow, oh, wow, oh, wow. And I think that just shows his appreciation of his family and what he had built. Not Apple, but the family surrounding him. So back to that hospital bed. Do you have an idea what it costs? So if you're just being fed and lying there, not much interaction with more than the nurses, this is going to cost, I'm talking cost, $500 a day. More or less in different countries, but you kind of, WHO gives you this information. It's about the same thing. Now, when you think of $500 a day in cost, I know when I'm paying $500 a night, I'm kind of expecting rather this. That's more what I would be thinking of. So that means we have to keep in mind that lying in a hospital should be a conscious decision for each and individual patient and has a huge impact on our healthcare system. Now, the session is called Towards Sustainable Healthcare System, and so, I mean, when you think how sustainable, something comes into your mind, but I wanted to look like, what does it actually mean? Am I really on the same page as what Merriam-Webster says? And so you look for the word sustainable, and it says it's involving methods that do not completely use up or destroy natural resources. So basically kind of the definition that you use when you're thinking of our whole planet and what we're doing to it or not doing to it. Certainly, there's there's relevance of this for the healthcare system, but it's not exactly what we're looking for when we're talking about a sustainable healthcare system. So I looked further, and there's a second line, which is able to be used without being completely used up or destroyed. Kind of the same idea. And then the last one, able to last or continue for a long time. Now that's, I think, rather what we're looking for in a sustainable healthcare system. So what is the cost of our healthcare system today? Does this graph look sustainable to you? 21% rise in worldwide expenditure of over 20% in 10 years, and expected to rise by even 44%. The silver bullet in this context is always called e-health. Now, e-health promises many, many things, and these promises are accompanied with quite a market valuation. I mean, just the mHealth market alone is valued at $21.5 billion this year. Now you're going to say, oh, he's going to be bashing mHealth here. How could I do that? I mean, I myself created a company, and I'm working with a wonderful team on a mission to connect medical devices. So I'm certainly not going to bash the industry that we're in ourselves. So let's look at what the major impact factors are. first thing that comes to mind is age, or ever-aging population. That's something everybody knows, right? You take it for a truth, for a given. We're aging. Unfortunately, we're aging faster than we are catching up with healthcare, meaning that we're actually spending more time on this planet being sick rather than being at good health. But then WHO tells you that actually isn't such an important factor. What really drives costs up is actually medical technology. Oops. Basically, the same industry we're just about in is now telling me that that is what drives costs. We're like, that might not be ideal. But then you dig a little bit deeper, and you look at who is causing all, or a large portion, actually, of the financial burden. And you figure out that there's about 20% of the patients that are causing 80% of the costs. And these are patients with chronic disease, most notably cardiovascular disease and stroke. Now, of course, these are somewhat interrelated. I mean, age and cardiovascular disease correlate. That's one thing. And you might be saying, well, I mean, the other thing is genomics. I mean, what can I do about my genomics? Well, there is one particular group of patients with a very high prevalence of cardiovascular disease and stroke, and that is diabetics. Diabetics are actually 2 times more likely, 2 to 4 times more likely to have cardiovascular disease and stroke than any other patient. And that leads to, today, over 400 million people suffering from diabetes, incurring over $825 billion in costs. Now, that's a large number with many zeros, so we have to put it in context. Context number 1, that is 8% of the worldwide expenditure in healthcare. 8% only the 400 million people who have diabetes. Or, in a different number, there's one very busy country on this planet, the US, the United States of America. It's 50 times their GDP that we're spending every single year on diabetic patients. And by 2025, this number is supposed to go up by 75%. Now you might be saying, well, okay, that's one thing. Of course, I understand. But again, genetics, what can we do about this? Well, 90% of these patients are actually type 2 diabetic patients. And type 2 diabetes is mainly due to lifestyle choices, so our own choices, nothing to do with genetics. And there are 3 factors that drive this. Number 1 is this, the fact that we don't move sufficiently. Number 2 is this, people who smoke. And number 3 is alcohol abuse. So I'd say these are actually factors that we can influence, that we can work on. They are causing 8% of our healthcare expenditures. So digital health, with all its data and tracking and AI and everything that you can do with it, it's amazing. And for sure, it has large potentials. That's once we have surpassed all the legal and social and structural problems, it's going to change healthcare forever. And it will be able to deliver on the promises of avoiding readmissions to hospitals, taking care of the patient at his home and not in the expensive bed, getting rid of any inefficiencies that we have in the medical system today, putting Dr. House basically at the palm of everybody's hand with his incredible diagnostic capabilities, and providing access to the remotest homes on this planet. But all of these efforts, all of them, are going to be completely useless and just a drop in the ocean if we don't get the patient and if we don't get his responsibility. E-health wants to empower the patient, wants to put him at the center, but at the same time, we need to work on the fact that he's also responsible in the process. And if we, as a medical device community and the whole medical community as a whole, do not manage to transmit this information to the patient, that he is also responsible, then all our efforts will be lost. And I'm pretty sure that a tiny device that was revolutionized by Steve Jobs will play a big role in this revolution. Thank you very much.